So, demographics in prison. In 2006, Aboriginal people in Canada reached 1.18 million people, or about 3.75% of the Canadian population. And in 91-92, we made up 11% of the federal corrections population, and in 98-99, this percentage grew to 17%, completely overrepresented. And there are a diverse array of factors, not just one single issue. There are a great many places we can intervene to try and help this overrepresentation of Aboriginal peoples in the correction system. Aboriginal women represent 18% of the women's federal corrections population. A goodly number of women, lots of young women of reproductive age, and 2/3 of these women are mothers, and about 70% of them being single parents, with the risks attached to being single parents of poverty and risks around educational attainment, and risks, of course, for their children. And I should comment here, even though I haven't officially responded in my provincial capacity, that Aboriginal women separated from their children really perpetuates the problems of children in care. So we've seen that the prevalence of substance use and mental disorders in prison populations is quite significant and worth noting. And that Aboriginal offenders are particularly high risk, i.e. they're higher risk. However, the information on these, for instance, we know that substance use disorders amongst Aboriginal prisoners are overdiagnosed compared to the general population, and that their mental health disorders are underdiagnosed compared to the general population. So what does that mean? We need to know a lot more. We need to do a lot more research. We need a lot more data. We need to hear from prison populations what's happening with you. So let's look at the historical context. Some of the risks concerning mental illness, substance use, and corrections involvement are the same for Aboriginal populations everywhere, that they are a result of social forces occurring over lengthy periods of time. 63% of Aboriginal offenders reported having been adopted or in foster care during their childhood, compared to 36% of non-Aboriginal offenders. This is quite significant. Aboriginal children continue to be disproportionately represented among children in the ministry's care. Approximately 50% of all children in care are Aboriginal. Remember, we are only 3.75% of the Canadian population, but in this province, we represent 50% of the children in care. And we know that the outcomes for children in care are exceedingly poor. They're very much an at-risk population. Approximately 1 in 20 Aboriginal children across the province are in the ministry's care, compared to 1% of the general population. And approximately 1 in 7 Aboriginal children aged 6 to 8 has been in care at some point in his or her life, compared to 1 in 50. And by age 16, 74% of Aboriginal boys in care have been identified as having special needs. Most of these special needs are related to intensive behavioral or serious mental health issues. And a goodly number of these end up in the prison system. In general, Aboriginal people are poorer, with general lower educational attainment, lower rates of employment, and poorer health outcomes. Basically, Aboriginal people have fewer choices when they're growing up about where they might end up. And so this is where one of our attempts in the health area is around the tripartite First Nations health plan, an agreement between the federal government, the provincial government, and First Nations governance to do something about these poor health outcomes that we've been seeing for more than 100 years in this province.